Okay, here we go. So today we have basically 90 minutes to cover a lot of information. And so we have these different 6 areas on the agenda that we are going to cover. I'm going to cover these areas within our objectives. So when we think of those agenda items in the objective, what we're doing is looking at how we're going to explore concepts of fiscal sustainability and how that's important in sustaining evidence-based practices within a county. We're going to look at analyzing those 6 elements of fiscal sustainability, a framework that we are working on, and you'll see what that framework is as we go through the presentation today. We're going to look at applying strategies for conducting a fiscal inventory and fiscal asset mapping. And these are areas that you in your county have probably accomplished, but we'll talk about the importance of what should be included in those and the importance of actually reconsidering those or reviewing those on an ongoing basis. I'm also looking at identifying and engaging strategic partners and how that is going to help you in your long-term sustainability of an evidence-based practice. Looking at how to identify and develop sustainable budgeting approaches for those evidence-based practices and how that's going to look when you're looking at braiding and blending of different funding streams. And we'll do some of those areas through looking at some examples. And then lastly, we'll look at risk management and CQI practices and how to maintain fidelity and adapt to evolving needs as we move forward. To start the process, we wanted to do kind of an opening activity. And so in the chat, if you could also share, or even if you want to take yourself off mute and share real quickly, what sustainability means to you. So when you think of sustainability, go ahead. Any thoughts around sustainability? Like when you think of that, what does it mean for you?
Ongoing support, uninterrupted support of programming.
Mm-hmm. Yeah.
This is Nicole in Modoc, and I would have to say buy-in that's at a systematic level. So all of our partners are working for a same cohesive type of system.
Okay. So looking at that collaborative components. Excellent. And so thinking of those and thinking of, that what sustainability means for you as you're doing this work. Also, can you share an example where you've had an opportunity where an evidence-based practice that you've tried to implement in your county has failed, and that's due to a lack of fiscal sustainability? Like you started it out, you went through it, you started, and then you did not have success. So do you have situations where you've had that in your county? Does anybody not have that situation where it's occurred in their county? Okay, so not hearing that anybody hasn't had that situation. When you think of your county, what challenges do you have in sustaining evidence-based practices?
I'll say a lot of times something new, a new program or a new evidence-based practice is started with some startup funding, like some block grant funding or some one-time only funding that's intended to build capacity, and that funding goes away. And it's challenging sometimes to then figure out how to identify county funding or other funding streams that can replace that startup funding and even allow the practice to grow over time, which is what we want to see happen. So, and I think that that's really a key challenge right now in California, as folks have this block grant money, and now we have to figure out how to make the jump from the block grant money to the 4E claiming, but there has to be that 50% participation from other sources. So that's been my experience. And I see somebody is giving me a thumbs up, and I got a second in the chat. So
yep. And that's exactly, I think, the situation that you're describing, Melissa, is that, we start out, we have something to initiate, and then those funds go away. And so we have to figure out how to sustain. And so one of the components that we're going to, or the pieces of components that we're going to be talking about as we talk about the elements throughout this morning is how to consider that through your planning and how to consider that as you're looking at sustainability so that you have the best chance of being able to have that sustainability of that evidence-based practice. So I'm going to turn it over to Jennifer, and she's going to kind of do an overview of our elements real quick.
Thanks, Brenda. So before we explore the 6 elements that we want to talk about today, I want to briefly discuss why this framework matters to your work. And I think we're hearing some of that today in talking about the worries, right? We've had the state block grant for some, potential one-time funding, and how do we really work collaboratively and come together to do that planning on the front end, so that we're not just, building our planning and system around, let's say, that one funding source, for instance. So it's really about creating a system that can adapt and last as your needs and partners and resources change. And this framework was developed to help counties move from short-term solutions to long-term strategic planning. And each element addresses a key part of that process, from understanding your current resources to hopefully being able to identify new funding, building partnerships, and then planning for risks that are inevitable, right, in implementation. So whether you're in a large county with complex systems or a small one with limited staff, we hope that you will find these elements are scalable and adaptable. And most importantly, the elements work best when used together. So they build on each other to form a comprehensive strategy that supports not only implementation, but also long-term sustainability of evidence-based practices. And while the elements are presented in sequence, they're not strictly linear. Counties may revisit earlier steps. You probably are finding, as we go through it, you've already done some of these, but maybe this is an opportunity to refocus. And whether you're looking to, select an original evidence-based practice or an additional evidence-based practice, hopefully this will give you a framework to be able to apply the elements, concurrently, or adapt them based on your evolving needs and your partnerships in your communities. Slide 7, thank you. So this slide presents the 6 elements of fiscal sustainability as an intentional process. And it begins with understanding your current fiscal landscape and progresses through identifying funding, building partnerships, and developing a sustainable budget. And then the final steps involve monitoring and adjusting, ensuring that there's resilience through conducting risk management and your CQI processes. This process assumes counties have already selected the evidence-based practice that they plan to implement based on completed needs assessments or gap analysis. And so with that foundation, the 6 elements guide how to align your funding, your partnerships, and planning to support that long-term sustainability. Brenda, are you still with us?
Whoops, there we go. Sorry, my thing muted. I apologize. So here we're going to actually, now that we've reviewed the fiscal sustainability framework, we're going to basically look at these first 2 elements. And so we're going to look at fiscal inventory and funding discovery. And in these steps, counties can understand what resources they currently have and how to identify new funding opportunities. Together, they will provide a comprehensive view of your financial landscape and set the stage for strategic planning and partner engagement. And so here what we're looking at is kind of a flow in relationship to building that strategic fiscal foundation. We start by looking forward with a fiscal inventory and a comprehensive catalog of existing funding sources, which includes federal, state, local, and private funds. This step allows us or helps us understand how much funding is available what restrictions apply, and what services these funds support. Next, we move to fiscal asset mapping, which provides a visual on how these funds are distributed across services, populations, and prevention levels. This helps identify overlaps, underused resources, and service gaps, which are critical insights for optimizing funding. With that foundation, we then shift to the funding discovery, exploring new or external funding sources that will align with identified needs and strategic plans or strategic goals. This might include federal grants, state initiatives, philanthropic support, or Medicaid waivers. These steps are collaborative, engaging your AB 2083 partners, engaging your programmatic and your fiscal leads, as well as your community partners is going to be essential in the process. Think of it as a strategic sequence. So on the inventory, we're looking at what we have. In the mapping, we're looking at how it's used. In the discovery, we're looking at what we need. And no matter if you're a large county where you have formal structures or you're a small county where you're using informal check-ins, the key is going to be consistent and inclusive collaboration. And so we're going to now kind of look at each of these more in detail. And so we'll start out with fiscal inventory. So here is an example of a fiscal inventory. And so we're looking at the starting point for understanding what resources are already in place to support your prevention services. It's going to be more than just listing your funding sources, such as your Title IV-E, your Medi-Cal, your MHSA funds, your first 5 California funds, or your philanthropic grants. It's going to be about documenting and funding and how much funding is available, what restrictions apply, and what populations or services these funds are supporting. This identifies and or helps identify any duplication, understanding, or gaps, and prepares counties for your braiding and your blending strategies and opportunities. And again, whether you're a large or your small county, this process can be scaled to your capacity. So in here, you'll see you have your candidate population. You're looking at your prevention categories. And so you're looking at your primary, your secondary, and your tertiary. Then you're looking at your service categories, and you're breaking it down into what type of service you're looking at. And we have this set up in relationship to Family First when you consider the 3 areas the Family First supports. Your service name, and then where those funds are coming from. And then you can also look at the top portion of this where you have now your graph where it's now telling you the percentage of where all those funds are falling. This is our fiscal asset mapping. And so when we look at this, it's going to help visualize our funding and how our funding is distributed across services, populations, and prevention levels. So this is going to show us what is in those primary, secondary, and tertiary levels. And that's going to be your bar or your pie chart on your left top. And then it's also going to show you on your the bottom of that where those prevention service category fundings fall. And then over on the right side with your bar chart, it's going to show you where the funds are and what it's supporting in relationship to those populations. For example, Title IV-E might be able to support, in relationship to this, when you're looking at that, you're going to also look at your key questions. And so we're looking at, now that we know the populations and where these populations fall, we're looking at which populations are underserved. Do we have overlying, are we over relying on one funding stream? And is that funding stream going to be maintaining, or is that going to be a funding stream that we're not going to be able to maintain past a certain time point? We're also then looking at our services aligned with our community needs in relationship to what we've identified is a need in the community at that given point in time. And then for an example, when we consider that, let's look at Title IV-E and seeing how Title IV-E can help support a parent education for children that are not involved with child welfare over the age of 6, while First 5 could fund and support home visiting for families with children of 0 to 5. So we start seeing how we can start doing that kind of braided funding and how we can support initiatives through multiple different areas. The collaborative nature of the exercise will bring valuable insights across your continuum of prevention services. The goal is to create a visual representation that will help inform your decision-making and help you as a county align your resources with your comprehensive prevention plan. So let's take this into the last level here in relationship to our funding discovery. So finally here, we're looking at our funding discovery will help us identify new or external funding sources, It lets us know the answers to those questions in those key areas. And you'll see the key areas here that are highlighted on the top portion. Will help a county to expand resources, support evidence-based practice sustainability and innovation, improve efficiency, foster collaboration, and increase accountability for measurable outcomes and data-driven decisions. So it helps securing adequate funding for all your programming, and we know that that can be challenging at times. So maintaining updated inventory, asset mapping, and strategic partnerships is going to be essential for your sustainability. So you're treating this kind of as a continuous quality improvement process where you're going to have regular review and updates of these processes. So as I highlighted, you may have done this as you were preparing your comprehensive prevention plan. You may have revisited these as you're considering what that may look like now as you're in implementation. As you're looking at how to sustain and move forward, you also are looking at how do I identify potential additional funding. So this will help identify what that may look like, but we also can turn to different areas such as the philanthropic and foundation grant opportunities. Local and regional foundations are going to give you basically how to fund different components in relationship to family stability or youth development and community health. And so these could be having or building partnerships with your prevention goals in mind. These can be partnerships within your community. It could be partnerships that are more national, such as Annie E. Casey Foundation or Blue Shield of California Foundation. You're going to use your data and community stories to demonstrate impact and sustainability in relationship to this. You're also going to be potentially able to look at public or private partnerships and looking at how to engage your businesses or your local partners in supporting your workforce development. Maybe that looks different in relationship to how you've supported that historically, but basically partnering to build for your entire community. That also could be in relationship to mentoring or wraparound services. Looking at how to braid your funds. You know, sometimes we only braid within our agencies or only within our sections of a department. So maybe just child welfare only with child welfare. We're looking at how do we expand that across and build that further into other areas. And so that can be combining our county general funds, our First 5 funds, our MHSA funds, school district resources to support and look at what those shared goals are. And we're looking at braiding to help maintain that compliance with maximizing flexibility to the highest level as possible. As we're working through this process, it's also leveraging Medi-Cal, looking at what opportunities are in place, what opportunities you're using as a community, and where can we further enhance or build into those. Partnering with your managed care organizations to fund your prevention services that will reduce the cost of your high-cost interventions later on that primary side of prevention. Really building into the community-based organization collaboration. So looking at what access to funding many of those community-based organizations may have. So that may be through private grants or flexible funding streams that may have more opportunities or more options than some of the existing funding streams that you've historically utilized. Counties can co-locate services or share staff to reduce costs and expand your reach in relationship to how to best support an initiative. Also, we can look at universities and research partnerships. So how to collaborate with academic institutes such as for pilot funding, evaluation support, or utilization of interns in the work that is occurring. Universities also may have access to research grants that other entities in the community may not be able to access. And so that will help support any of the innovative prevention models in relationship to helping support moving forward into some of those practices within your community. Another area would be looking at social impact bonds and looking at how these can secure private investments for prevention programming, looking at how to best support interventions as well as those preventions, and helping support the measurable outcomes in reducing ultimately the foster care entries. And then lastly here, we're looking at potential like local ballot initiatives or tax measures where some counties can have or successfully pass local tax measures to help fund children and family services in their communities. This will require a strong community engagement and clear messaging in relationship to the benefits to reflect that community support. And then lastly, you can look at multi-county collaboratives, pooling your resources to fund shared prevention infrastructures together. So this could be through data systems, training, evaluation, looking at how to basically support the work, looking at it through a multi-lens across a region or counties in relationship to that. Many times small counties can't afford standalone systems, but they can benefit from those shared services and systems. And so thinking sometimes in the manners that we have, or thinking uniquely or differently, which is going to best support your county, may benefit you to the highest level. Okay, so I think we have a question in the chat, how to best identify or connect with potential grants. And so some of it is going to be through looking at looking at what's in your community, seeing what's available, having those conversations with your collaborative partners, finding out what funds they have. So through that fiscal asset mapping and looking at your fiscal asset mapping in relationship to identification of what that has looked like where you are, and looking at then how you got to what is already existing compared to what's available. And those are going to be through these three components, as well as those collaborative pieces that we'll talk about shortly. Melissa, you also have your hand up?
Well, I really appreciate what you're talking about, and it's giving me a lot of thought about how this is kind of reframing the traditional relationship a child welfare agency may have had with a service provider, where we're used to a strictly contractual relationship, like we pay you to deliver this service, you send us an invoice. You're talking about developing a partnership so that funding streams can be leveraged, braided, and blended through both entities to provide sustainability to both entities for providing that service.
Right.
So it's a really big mind shift for me, and I'm sure others on the call are, exploring that within their minds. And so I wanted to also put a little plug in for the TA that you'll mention later. So when there are things that come up like that you're thinking, I don't know how to do that. We're going to talk, or the ICF partners will talk later about how you might access some TA to help you think through some of these things or identify those funding streams.
Yeah, and that's a great point, Melissa, is that the relationships may look different. And so sometimes that's, as we're moving into this prevention world, we've been making changes. And so some of those changes may have been easier. Some of those changes may be more difficult. We have the relationships, we may just have them at different levels. And so it's going to be expanding into those as well. But it really is a shift of, how do we really as a community look at this compared to one entity in relationship to moving forward. So that is a great.
And Melissa, when I reflect back to some of the projects or initiatives that I was involved in with local government, I think there's a lot of value in, so we may go and attend a conference and we hear about, really good things that are happening in a particular community. But I think a lot of that information I've found is like in that research, right? Researching what are other communities doing, and then when you research whatever model that is, right? A continuum of prevention services or other. You oftentimes find information on like the funding sources, and a lot of that does go back to the philanthropic, grants that might be available, a Duke Endowment or oh gosh, it's MacArthur. I cannot remember MacArthur grants for the juvenile justice or the justice continuum. So I think it's really just continuing to do that research, right? If you are thinking about, a certain program, to get ideas in doing that research, I think is helpful. And your TA provider could help you do that as well.
Yeah, that's
And I
the
can,
thing. It's daunting, right? It can, for some folks, it's a whole new world and it feels a little daunting to think about grant applications and things like that. But
Yes.
right.
there are resources available to support. Thanks for putting that in the chat too, Brenda.
Yeah. And think of it in relationship to really, you know, these three processes that we've just been discussing as well. It's really kind of working through them again to identify like, where are your gaps? Where are the areas that you need that additional support? And then that TA support can help and help move you along that process.
And I think Wendy put a great comment with question in the chat too.
Yeah, I was just noticing that. Thank you, Wendy. She's talking about how it might be beneficial because California, every county has a child abuse prevention council. And, you know, that's an area where you're bringing a lot of these community partners together, and that could be, you know, a place to start your funding discovery. She further asks about, are there any guiding tools or questions that can help initiate the discussion? I'll have to think through in the guide. If it's not something that we have included there, because the guide will eventually have several like appendices, right? And so maybe that might be a great appendices that we could add to that, Wendy. So thank you.
And the guide that we're referencing is an evidence-based practice sustainability guide that will be available around mid-September in relationship to this PowerPoint as well, and the recording. So it'll be an additional tool that will be an option for individuals to access and utilize through their county. Okay, great questions and comments. Okay, so we're going to keep moving us along. So here we're going to actually take this and break it into an example. And so throughout our webinar, we're going to be using parents as teacher as an evidence-based practice, and we'll build out different areas around the elements to see what this would look like specific to an evidence-based practice. So here we have parents as teachers. We're looking at element 1 and 2. So this is going to be your fiscal inventory, your mapping, as well as your funding discovery. So when we look at the inventory and mapping, we're looking at that we've identified our existing funding streams. So we've identified that we have TANF, Title IV-E, and MIECHV. I'm never going to be able to say that correctly, so I'll just spell it, and county general funds. And then we've also have now mapped out, or we're, you know, have in the process of mapping out what that current home visiting services and referral pathways will look like. So we haven't identified what that may be. And then we've assessed that there's gaps in service delivery for families with children ages 0 to 5 and 6+. And so we're looking at what those are and where those fit, so that we can look now, how do we meet some of those areas through some of this additional funding opportunities. So through our funding discovery, we're going to explore new funding opportunities such as CalWORKs, Medi-Cal, or those philanthropic grants. We're going to have a good time with that word today. We're going to look at aligning fund sources with referral populations and service needs. And then we're looking at that fiscal asset mapping to help identify where we have underutilized resources to really help support this goal of implementing or sustaining parents as teachers, or potentially expanding that into the community. So the key takeaway here that we want to look at is this is going to basically help counties in looking at how elements 1 and 2 can support your strategic planning, identify those funding gaps, and inform your decisions on resource allocation and sustainability. I'm going to turn it over to Jennifer to help us start bridging into some of the strategies of what this will look like.
So at this point in our discussion, and let's say in our process of where we're at with establishing our evidence-based practice. So we've completed our fiscal inventory and our asset mapping and are beginning to explore the funding opportunities. And so this is a really ideal time to pause and conduct or refer to a SWOT analysis. So maybe some of you have already conducted SWOT analysis, or this would be a good time to use that as a tool. And so SWOT is, you know, outlining and assessing strengths, weaknesses, opportunities, and threats. And this helps counties reflect on both your internal capacity and then the external conditions that might impact you in your implementation. And it bridges the internal assessment of what you have with the external exploration of what you need. So again, pairing that, right, with exactly what Brenda's kind of talked through about, we've identified what we have and we've identified what we need. And then let's talk about that in the context of strengths, weaknesses, opportunities, and threats. So a SWOT analysis helps to align your funding strategies by identifying internal strengths like stable funding or skilled staff, and weaknesses such as fragmented systems. And so it also highlights external opportunities like new grants and threats like workforce turnover, which can guide your outreach and your engagement. Conducting the SWOT collaboratively with partners is really key because it helps to surface blind spots and then assumptions that agencies may not realize. For example, a community-based organization may be unaware of upcoming legislative or policy changes, while a county department may not know the extent of staffing challenges that the community-based organization faces. So sharing perspectives helps uncover these overlapping challenges and to help build a more coordinated strategy. And this is especially valuable for smaller counties where prioritizing actions and aligning efforts is critical. So let's use workforce turnover as an example. So it's a known risk, and counties might engage partners with training infrastructure or academic institutions to build a pipeline for skilled staff to implement your evidence-based practice or other pieces of your prevention, pathway or program. And fragmented systems are another common challenge. For instance, child welfare and behavioral health may operate separately, while a community-based organization provides parenting support but isn't connected to either. The SWOT analysis provides insights and can guide your partnerships for you to be able to create shared referral pathways, co-locate services, or establish joint data sharing agreements, which ultimately leads to a more integrated and responsive prevention system. And so before we move on, and as we're moving on to the next segment, if you wouldn't mind sharing in the chat, can you share a strength or an opportunity that your county brings to sustainability planning? I'm seeing skilled partners. I think we find that a lot, right? Especially with our community-based organizations. Great. So some already existing strong collaboration. Awesome. So Brenda, do you want to move us into our identifying and building partnerships?
Sure. So we're going to move into our elements 3 and 4 here. And so thank you for sharing your reflections in relationship to some of the strengths. And then, how those collaborations and skills that you're utilizing in those counties have built upon the work that you're doing. And so we're going to talk about how the SWOT analysis helps us move from the understanding of the position to identifying who can help us move forward. So sometimes we get stuck and we're not sure how to get past where we are. And so these are, again, some of those opportunities where your technical assistance, if you feel like you're in a space like that, you can reach out and seek some technical assistance. But it's also a good time to turn to those partners that you already have or that you're building to start having those conversations as well, to see how we can move to that next step forward or one more step in that direction. So we're looking at how we've mapped our resources and assessed our strategic position. And so our next step is now going to look at those strategic partnering, identifying collaborators whose missions and resources align with our goals and that we have in mind. And we're going to start exploring how to engage those partners in a meaningful data-informed collaboration that's going to help support that long-term sustainability. So on here we have that we've done the fiscal inventory, we've done that asset mapping, we've done the discovery, and all of those have revealed our opportunities and our gaps. So now we have to identify what those next steps are and turn those insights into actions through the partnering, and that's strategic partnering specifically. So we're going to have here, we're going to start with identifying the strategic partners, looking at those whose missions, resources, and readiness align with the needs that we've uncovered, and then move into engaging those partners in that meaningful data-informed collaboration. We're going to look at distinct steps to accomplish that. And these are going to be closely connected. So sometimes you may be moving between one into another, or you may be moving back into another step, depending on where you are with one partner over a different partner. Together, it's going to transform your fiscal insight into shared action and lay the groundwork for sustainable implementation. Your partners may include your AB 2083 agencies, your community-based organizations, your philanthropic funders, and other public systems. And the goal is not just to find contributors, but to build a coalition that's going to share ownership of both your implementation and your sustainability. Remember, we're looking at the entire community at this point to support. The process is going to be critical because, one, it aligns fiscal gaps with your partner strengths, which is going to ensure that your resources are matched to the needs. It's going to build on that shared ownership, which also is kind of the shared accountability, which is going to increase long-term commitment and that accountability overall. It's going to expand capacity through that cross-sector collaboration. And it's going to bring in diverse expertise that maybe we haven't utilized previously and didn't even know maybe even existed. Leveraging those existing relationships, though, as well. So these could be, again, through those AB 2083 partners and looking at strengthening and coordinating the trust in the relationship with them as well. So as we're building new partnerships, we're maintaining the existing ones as we move forward in this work. It's going to be important in these transitions for us to identify from moving from identification to engagement, from knowing who we need to actively involving them in the decision-making and delivery. And this is sometimes a key area that we can get, again, stuck in, that we identify who they are, but we're not sure what those next steps are. And so those are, again, opportunities to work through that with those partners. But also, if you feel like that you're not making progress, then really looking at some of the TA support that can be provided to you. Now that we have that foundation, we're going to walk through some steps on identifying and engaging the partners who can help us move from planning to that sustainable action. So here we're looking at some of the steps to engage these partners. And so our strategic partnering is a process that will begin with identifying the right collaborators and continues through meaningful engagement. These 5 steps guide counties from understanding what support is needed to build strong, sustainable relationships. And it's actually these 6 steps, so I apologize for that. We start by assessing needs by clarifying the funding, staffing, infrastructure, and expertise required to implement and sustain evidence-based practices. This helps define the type of support we're seeking from partners. It helps provide that clear communication so that everybody knows what is needed and what they then can help provide or not provide. Maybe it's an area that they don't have that available. Next, we identify potential partners whose missions and capacities align with our goals. This can include our AB 2083 partners, community-based organizations, philanthropic funders, and other public systems. Once potential funders or partners are identified, we evaluate their fiscal readiness, ensuring they have the systems and the capacity to manage the funds, meeting any of the reporting requirements, and then contribute to the sustainability. Then we move into engagement. And here we're looking at making sure that we have clear data-informed proposals that show how the partnership supports those shared goals. We're looking at tailoring our communication to each partner's priorities and leveraging these existing relationships to help build that trust and momentum. So what your engagement or your communication with one partner may look very different in relationship to another partner, in relationship to helping support that tailored communication. And then finally, we're using partner evaluation to basically have here a partner evaluation matrix to compare and prioritize what those potential collaborators based on the strategic alignment, capacity, and readiness may look like. This is going to help formalize the partnerships that are built on shared values and long-term sustainability. And then to maintain momentum, it's going to be essential to tailor that communication to each of the partners' roles, priorities, and level of engagement. Sustaining collaboration over time requires consistent outreach, shared planning, trust building, and this is going to be especially true with our AB 2083 partners and any of our community partners. Together, these steps ensure that our partnerships are intentional, aligned, and basically capable of supporting any evidence-based practices that we are looking at now as well as into the future. So let's look at a partner matrix example. This is a strategic tool that helps us assess the landscape of collaboration. So it identifies key partners, their roles, their contributions, and the risks associated with each relationship, such as funding limitations or workforce turnover. This matrix is especially useful during the engagement phase, helping counties prioritize who to bring to the table and how to structure these partnerships for long-term sustainability. But while the partner matrix focuses on the external relationships and collaboration risks, the next tool that we'll be discussing later on is the risk matrix, and Jennifer will highlight this in a broader view as we move forward into these different elements. That's going to help us look internally at and systemically at all the risks that could impact our evidence-based practice for sustainability, including operational, financial, and implementation challenges. When you consider this, what risks are most relevant to your county? So we have smaller county agencies that know each other and collaborate well. Excellent. And so when you think of the risks here, what do you see most often in your county? Or what is going to be most impactful to your county?
I'm seeing staff turnover and burnout, Brenda, in the chat.
Oh, thank you. Yes, I think that is very true. We know as a nation, we've had staffing issues across different areas. Those staffing issues have continued. And with long-term continuance of that, it has different impacts, and that has makes it much more difficult for sustainability. So let's consider this through our parents as teachers example as well. So here we're looking at our elements 3 and 4 that we just discussed, which is identifying and engaging our strategic partners. Here we looked at engaging CalWORKs, public health, behavioral health, and our CBOs. We were able to identify partners who could co-fund, provide referrals, or other infrastructures. And then based off of that, we're now assessing partner readiness and alignment with our parents as teacher goals. This and the previous example from elements 1 and 2 of our parents as teachers shows how counties can use our elements 1 and through 3 to build a strong foundation for budgeting and sustainability. Remember, it's not just about funding, it's about aligning our resources, our partners, and our community needs to best support our high fidelity evidence-based practice implementation. And I'm going to turn it over to Jennifer to start talking about our budgeting.
So now that we've explored the partner matrix and discussed how to identify and engage our strategic collaborators, I want to shift focus to the next phase of sustainability planning so that we can put the plan into action. And so the partner matrix helps us to understand not only who our partners are and what they bring to the table, but also the risks that may arise in collaboration, like workforce turnover, funding delays, or service disruptions. And these insights are critical as we move into element 5, developing a budget for our evidence-based practice sustainability, as well as element 6, where we want to ensure that we are evaluating and mitigating our risks, and then also moving into that continuous quality improvement cycle. So these final 2 elements help us translate our partnerships and our funding insights into a concrete fiscal plan, one that can adapt to challenges and maintain fidelity to our evidence-based practice model over time. So slide 22. A sustainable budget isn't just about numbers. It's about aligning your fiscal plan with your program goals and community needs. And so this slide outlines key components needed to do that. We want to start by identifying our core costs: personnel, materials, operations, and training. And then we apply braiding and blending strategies to maximize the funding while we maintain compliance, because we want to be sure that we are considering our payer of last resort and the non-supplantation rules, especially when using federal funds such as Title IV-E, Medi-Cal, or McV. This includes a contingency plan to address our funding gaps or service disruptions. And finally, using your fiscal inventory and your mapping along with CQI data, we should monitor and adjust the budget and or the programmatic elements as needed over time. So as we build our budget, it's essential to understand the compliance landscape. This slide highlights 2 critical concepts: the payer of last resort and non-supplantation. Each funding stream has its own rules. We're going to want to make sure we clarify what's allowable versus not allowable, per that funding stream and eligibility, the timelines associated with that funding stream's availability, and the reporting requirements. And when braiding funds, it's essential that we maintain separate accounting for each source, even if they support our shared goals, because that's, part of the federal requirements. And then we need to work to align the funding with the program components. For example, in our example, we use Medi-Cal for our mental health services, our Title IV-E for case management, and the philanthropic grants for training. We know that doesn't always hold true, so just using that as an example. And then we have to avoid supplanting by ensuring that the federal funds only supplement our existing services, not replace them. And so focusing on the compliance elements ensures that our budget is defensible, it's auditable, and that the funds are eligible for reimbursement. So what does that look like? So for partners, so Brenda, slide 24, thank you. So this slide highlights how partners can actively engage in budget planning. Melissa reiterated it, might look a little different, right? Oftentimes we are contracting for a service, but this is really engaging your partners differently. It's bringing them in, so not just as a funder, but as a co-creator of the fiscal strategy. And these approaches help to foster trust and transparency and shared ownership, to look towards successful, sustainable practices and programs. So budgeting for evidence-based practices must be a joint effort between fiscal leads and program staff. Too often, these teams work in silos, but sustainable implementation requires them to come together early. Fiscal leads bring expertise in funding sources, compliance, and cost allocation, while you all, as program staff, understand service delivery needs, population fit, and fidelity requirements. And when aligned and we come together to do this co-creation, your organizations can build budgets that are both strategic and feasible.
Jennifer, we
Or
have a
suggest-
couple,
Go ahead.
we have a couple comments in the chat. Well, one
Sure.
comment that people have been highlighting in relationship to the payer of last resort, non-supplantation and eligibility are significant barriers or the most complicated to tease out. And so I was asking if any individuals wanted to share like how they've handled those barriers within their county, or being able to, you know, highlight that a little bit further of what recommendations we would have for that.
So a couple questions also.
I think, I'm sorry, I put that in the chat. This is Wendy here. Sorry.
Thanks, Wendy.
I think it is unclear with all the departments, all the stakeholders, as you know, everybody's like, oh, we can't supplant, we can't be, we're always the last pair. Like, what is that cutoff? What is that? The definition is always kind of murky, and everybody don't want to be the one violating that rule, right? Another thing I was thinking about in terms of having CBOs involved is that sometimes county can't have CBOs involved because they don't want to have any perceived advantages to RFPs, right? Or allocation, you know, whatever funding is open. So those are all kind of barriers that I really do hope the state is able to kind of shed some light on that, so that, you know, when we talk to the legal counsel, the lawyer, you know, they won't strike anything down. Anyways, so that's just my comment.
Those are some really good thoughts, Wendy. You know, and in terms of the process with CBOs and RFPs, I will say that, you know, I think a lot of that can be tied or could be structured right in your purchasing, either the state purchasing requirements or that which trickles down from your county purchasing requirements. Fortunately, in a previous jurisdiction, we weren't always tied. We didn't have to go out for bid for our service contracts. And so, you know, that wasn't a barrier that I experienced in a previous jurisdiction, because we could bring those community partners together and we could plan in a really collaborative way and map out what it is that each of us or each organization could contribute to the whole. So I definitely, you know, hear and understand your frustration about, you know, how that might impact, or like it would be a conflict of interest, right, for your community-based organizations to attend then these pre-planning kind of meetings. I would have to give that some more thought about how you could, like, are there workarounds for that? It's a really good question. Still working through that, I guess. Was there anything else, Brenda, that we needed to answer or address here?
I think
And
not.
Wendy,
I think they were connected.
yeah, and I agree, Wendy. You know, sorting out that pair of last resort is really complicated, and that's why that communication and really talking through like each aspect down to the, you know, to the small detail about what we're using that funding source for, and then ensuring that we've got the proper tracking on the back end when we make that decision about which fund's going to support what, and keeping that documentation is all about the, you know, maintaining that compliance.
I like Bree's question in the chat. I don't know if you guys already spoke to that and I didn't hear you.
Yeah, I think we combined it with Wendy's.
Okay.
Yeah. But I think that is, you know,
Yeah, about
challenges.
having CBOs in the room, right, for that planning process.
And we can take that back and look into that a little bit further because, as Jennifer shared, each jurisdiction does have different requirements. And if you are having to put it out to bid, that may look very different, for you and your jurisdiction than some of the other jurisdictions that we've also either worked in or supported as well. But we can consider what opportunities may be available in those situations too.
So we wanted to, continue with this theme of our parents as teachers application in this budgeting scenario. And so I just want to put this out there that this scenario is hypothetical and is intended for, illustrative purposes only today. So these fund sources, I would just say again, hypothetical. So you want to verify all your assumptions, the funding sources and the allocations against your own data and program requirements and compliance before applying similar strategies. And while the fiscal sustainability framework is presented as a sequence of 6 elements, in practice, the process is often iterative. For example, we may begin budget planning in element 5. We revisited earlier steps like refining our fiscal inventory or re-engaging partners to adjust for new data or implementation realities. So this flexibility is important. Counties may move back and forth between elements as the referral patterns shift, or funding opportunities emerge, or partner roles evolve. And so this framework's really designed to support that kind of adaptive planning. And just to reflect back, so in element 1, we conducted a fiscal inventory and asset mapping to understand our current funding landscape. And in our planning, we identified in our hypothetical scenario that our agency expects to serve approximately 100 families, with referrals coming from CalWORKs, Title IV prevention candidates, and then MCV eligible families, and some county-funded populations. In element 2, we matched those referral groups to eligible funding streams, such as TANF, or Title IV, MCV, and county funds, and determined the percentage breakdown based on historical data and partner input. In element 3, we identified maybe some missing key partners, CalWORKs, public health, along with our already existing child welfare and community-based organizations who could contribute funding data and infrastructure support. And then in element 4, we engaged those partners in collaborative budget planning. We held joint workshops. We used fiscal asset mapping to visualize the gaps and the overlaps, and then developed protocols to define roles, responsibilities, and compliance expectations specific to parents as teachers. So now in element 5, we've translated that kind of strategic planning into our braided budget that is both compliant and sustainable. Each line item in the budget reflects the alignment of funding sources with program components, partner contributions, and compliance requirements. So as we walk through the budget matrix, I want you to consider how the strategies we discussed about engaging the fiscal leads and leveraging our relationships and aligning funding with our program goals, how they're reflected in each component of this parents as teachers example. And consider how the fiscal inventory informed the funding mix, and how our partner engagement shaped the allocations, and then how compliance considerations guided the structure. So let's continue with discussing our hypothetical. So personnel, we've allocated $150,000 for 5 parent educators and 1 supervisor with a half-time support staff. In our scenario, we are assuming that all staff are 100% dedicated to parents as teachers, because that simplifies our cost allocation. Funding is braided across TANF at 25%, Title IV at 15%, MCV at 4%, and county funds at 56%. We hope that's not the reality, right? We want to shift that county fund to significantly less. But this distribution is based on the anticipated percentage of historical referral types. However, once implementation begins, it's critical to track and monitor actual referral patterns if the referral mix shifts, because the budget scenario may no longer align with your original plan, and adjustments may be needed to maintain compliance and sustainability. Moving to training and materials, we've allocated $15,000 across county and McV funds because we determined that these costs are allowable under both sources and they support fidelity to the parents as teachers model. And the allocation is based on the proportion of staff and service activities that align with each funding stream's allowable use. For example, McV may cover training for home visitors serving the eligible families, while county funds support a broader implementation set of training needs. Our operational costs, we've set aside $20,000 for rent, utilities, and maintenance to be covered by county funds. If staff were not 100% dedicated, we would need to use a federally compliant cost allocation method like time studies, where we might be able to use Title IV-E or McV also in like braiding of that operational costs. For the indirect and overhead, $10,000 is allocated for HR, accounting, and admin support. So a proportionate share is claimable under Title IV-E and McV, noting that McV is capped at 10% for administrative costs. And then we've looked to build in our contingency reserve. So $19,500 is set aside using county funds to support financial sustainability. And while this isn't claimable under federal sources, it provides a buffer for unexpected cost or funding delays. And this budget reflects principles of braiding and blending, compliance, and partner alignment. And it's grounded in data that we've built collaboratively and is designed to be flexible and resilient. Are there any like initial thoughts about that scenario? I mean, is that helpful? What are thoughts? Maybe we could we'll continue into our CQI and come
I
back.
see
maybe?
Wendy has a hand up.
Oh, yes, Wendy.
Apologize, but keep talking. I'm sure folks
No, go ahead.
so annoyed. Because I'm annoyed because I'm really engaged in this. I just wanted to kind of highlight that I mean I love what you guys' scenario is, but for PAT providers or any provider, EBP providers or agencies, when we have braided, we have to be mindful that when we have braided funding sources and percentages of it, the data reporting and the administrative costs increase significantly. So I just want to throw that out there. When I saw this, I was like, okay, how do we even calculate all that? And there's a cap, like you said, maybe has a cap in that. So yeah, that's all the comments that I have.
That is one of the challenges of braided funding. And unfortunately, with especially the federal funding sources, we can't get around, right, some of that, unfortunately, tracking of some of those very specific details. So when we talked a little bit earlier about the need for when you're using braided funding is really trying to figure out how your accounting systems can help support that. I'd say that this is one area also where, a technical assistance provider, can help you break down the minutia of that and really, try to work to build a solid claiming process and system to report that. I hear you. It is a huge administrative burden, and not one to be taken lightly. Yeah. So we'll go ahead and move on into to this last element. Want to be able to leave time for any additional questions. But following building the sustainable budget, it's time to focus on our risk management and CQI. And so element 6 begins with identifying risks, many of which you maybe already surfaced during, when you've conducted your SWOT analysis. And it helps you to begin to anticipate those vulnerabilities and prepare for uncertainty, hopefully well before they happen. And Element 6 aligns with California's continuous quality improvement plan. It outlines statewide expectations for monitoring fidelity, outcomes, and continuous improvement. And so counties are encouraged to use the CQI plan to guide your CQI efforts and to ensure consistency with state level evaluation practices. Even the most well-designed budget can face challenges, funding delays, staff turnover, unexpected costs. And so it's not just about planning, it's about preparing for that uncertainty and working to continuously improve. So slide 27. So Element 6 brings together fiscal and programmatic sustainability through a unified continuous quality improvement approach. CDSS's fidelity framework emphasizes the importance of tracking fidelity, outcomes, and capacity, and the risk management steps outlined here directly support that. We begin by identifying and prioritizing risks that could impact the sustainability and fidelity. They could be things such as delayed reimbursement, cost overruns, programmatic risks like provider capacity gaps or fidelity drift. And this step is still often also, informed by the earlier planning tools with the SWOT analysis. It maybe uncovered internal weaknesses and external threats like fragmented systems, legislative uncertainty, and you are able to translate these specific risks within the matrix. We'll talk about the risk matrix here in just a second. So once the risks are identified, you want to work to develop contingency plans to be able to maintain your fidelity and your service continuity. The plans might include some what-if scenarios, some tiered service priorities, and strategies for alternate funding or emergency reserves. And CDSS expects counties to have these plans in place to ensure that your EBPs remain compliant and effective when those challenges arise. And so risk mitigation strategies are then implemented to reduce the likelihood and impact of the identified risks. This might include diversifying the funding sources, cross-training of staff, and then strengthening your intra-agency protocols. These actions not only protect fiscal stability, but support your uninterrupted high-fidelity service delivery. Data collection and analysis are central to CQI. And then partner engagement is also critical. I would encourage you all to come together to co-develop, just like we talked about co-developing the fiscal strategy, co-develop, what are those performance indicators, and review the data and the information along the way with regularity together. And then just a reminder, you all know this, CQI is cyclical. You work to refine your strategies based on your evaluation findings and schedule those regular reviews and share results transparently. And this is how this, brings together both those fiscal and programmatic plans so that you can remain responsive to the community needs and stay aligned. Slide 28 provides us with a look at a risk matrix. So in your planning, for example, California's, so CDSS's CQI plan talks about planning in the context of capacity, reach, fidelity, and outcomes. And this proposed risk matrix has color coding at the bottom that talks about those risks within the context of capacity, reach, fidelity, and outcomes. And this is what I mean. Capacity risk like workforce turnover or provider gaps are addressed through cross-training, technical assistance, and secure data sharing protocols. This might be how, the risk mitigation strategies we put out there, you know, if we are concerned about workforce turnover or gaps. Reach risks such as partner disengagement, grant expiration. We are saying that we'll mitigate those by maintaining engagement and developing long-term funding strategies. And then fidelity risks, such as included, so deviations from the model or delayed reimbursement. We're saying we hope to manage those through fidelity checklists, embedded CQI cycles, and, you know, really having done our work around determining fiscal readiness. So, Wendy, you know, are we engaging with partners who are willing and able to do that level of tracking that we talked about earlier? And then outcome risks, so like evaluation gaps or policy changes, you know, maybe that can be addressed by referring to and using Chapin Hall's measurement framework through diversifying our funding and proactive policy monitoring. And so we would just encourage you all to use this matrix with your partners. Again, in those, you know, conversations and collaborations about really working towards a systemic approach to your planning. Uh-oh, Brenda, you're on mute.
Sorry again. And so in summary, as we have looked at the different elements that we have walked through, we've walked through starting with our, you know, elements 1, looking at that fiscal inventory, now through our risk management and our CQI components. It's forming a roadmap for sustainable evidence-based practice implementation. And so as we move into the discussion, we're going to consider how your county can apply these strategies to build a transparent and a resilient and a community-aligned plan. And so here you're looking at, we have the fiscal insights that are going to, that helped guide that funding strategy. We aligned our resources or service gaps, or we considered what that would look like to be able to move forward. We engaged the correct partners. These could be our existing partners as well as any new partners that we needed to have shared ownership of that evidence-based practice. And then we now have built a transparent and a sustainable plan to be able to move forward with the evidence-based practice. Here is a checklist that individuals can utilize as a tool or as a resource to help provide a structured approach to planning and risk assessment. So it starts out with those core planning teams. It looks at who we invite for those key stakeholders or key partners, looking at that, having a structured meeting format, looking at that risk matrix template that we offered, looking at where we need to assign pre-work, and is there pre-work that we're going to have different partners support in relationship to that, and identifying those 2 to 3 anticipated risks that may be occurring. We're looking at having a collaborative discussion of what that looks like to move forward with the likelihood and the impact as we're moving through this process. And then we're prioritizing those top risks to use as a voting or a consensus tool to be able to proceed with the processes. And then lastly, we're doing that sharing and validating our matrix with all participants. And then we're doing the integration of that matrix into our CQI and our fiscal planning processes. And so we know we have covered a lot of information throughout this 90 minutes. We asked you as a county, as an individual, what is one action that you and your county will take after today's webinar? Throughout the webinar, we did share different resources. Additional resources include a toolkit that ICF has put together. Also, as part of the slides, you will see some federal guidance that we reference throughout the work that we do, and throughout the work, especially if you're looking at any kind of federal funding components. Also remember that the counties have opportunities for technical assistance through CFPIC. That information was in the chat. I'll put it in the chat again. And now we would like to basically open it up to discussions and questions that people may have at this point in time. Any thoughts that it produced as we went through?
Well, I just want to say thank you so much, Jennifer and Brenda, for putting this all together for us and walking us through these elements and the tools that you've provided. And I know you mentioned this earlier, but we will be providing a copy of these slides, a recording of this webinar, along with a comprehensive guide that will walk you through all these elements, and that has a huge amount of links out to tools, resources, and as Jennifer mentioned, appendices that can guide your thinking and conversations as you continue to engage in this sustainability effort. So I'm very grateful for the time and effort that you put into this, and for folks joining us here for the webinar today.
Yes, thank you for the opportunity to share information and be part of this process.
And I will just say one more time, because I really want, I want people to understand that we have funding available to provide TA for counties. So if you want to spend a couple of hours with a TA provider to walk through some of these options, set your team up for success in terms of considering some of this collaboration, identifying where to look or how to sign up for grant notices that come out, please click the link in the chat, and Derek and Sophia will connect you with a TA provider who can meet with you and help you get started in some of this. So thanks.
Thank you, everyone, and have a great rest of your day.
Thank
and your
you.
week.